Alright, now we have the sub-Q route. Sub-Q, a medication administered by a subcutaneous route, is injected under the skin into the subcutaneous layer. These injections are designed to produce a slower absorption rate than IM injections. Therefore, sub-Q administration. Hold on. Alright, sub-Q administration is not recommended for a medication that must enter the circulatory system rapidly, such as epinephrine in an anaphylactic reaction. The medication you would use administering the sub-Q route is Narcan. Okay, it's not something we use a whole lot. Alright, forms, a tablet. It's a compressed powder that is shaped into a small disc or elongated shape. It's going to be your aspirin, nitroglycerin. Alright, liquid for injection, a liquid substance with no particulate matter, because epinephrine is injected into the muscle. It's in a liquid form. Alright, Narcan is in a liquid form that can be administered intranasally with a mat or using a Narcan nasal spray. Gel, a viscous, thick, sticky substance that's administered to the patient. This is where your oral glucose comes in. It is a gel. Alright, suspensions. Drug particles that are mixed in a suitable liquid. These mixtures don't remain mixed for long periods of time and have a tendency to separate. Suspensions must be shaken well prior to administration. Alright, an example of this is going to be activated charcoal. This form of fine powder is actually a crystalline solid that's mixed with a liquid to form a suspension. Alright, because it's a suspension, it's necessary to shake the canister vigorously to administer medicine. It's going to be your metered dose inhalers. Okay. Medication appears as a mist or an aerosol. Each spray delivers a precise measured amount of drug to the patient. The medication is directly deposited on the mucosal membranes. Alright, mucosal lining deep in the respiratory tract. By depositing the medication at the desired site, the effect is more immediate and direct than when given by other routes, and fewer systemic side effects are usually noted. The medication comes packaged in pre-measured or pre-mixed fixed dose containers or inhalers. This is what your small volume nebulizers look like. You have the pipe and then you have the mask. Alright, oxygen is the most common medication you will administer, and it is a gas. It is inhaled and has systemic effects on the cells and the organs. Alright, a spray. Spray droplets can be deposited under the tongue. Nitroglycerin, often in tablet form, can also come in a spray form. I personally prefer the spray form. This is what it looks like. Each spray delivers a precise metered dose. You do not have to prime these either. Alright, for each medicine, you must understand the following information: indications, contraindications, dose, administration, actions or mechanism of action, the side effects. An indication for the use of nitroglycerin is chest pain, because nitroglycerin relieves chest pain. Okay. Contraindication. Low blood pressure is a contraindication for the use of nitroglycerin, because nitroglycerin lowers the blood pressure, possibly causing an already low blood pressure to become dangerously low. An absolute contraindication indicates that the drug shouldn't be used in this certain situation or condition under any circumstance, whereas a relative contraindication dictates that the drug isn't preferred but can be used if absolutely necessary and no alternative is available. Dose. It's important to distinguish between adult doses and children and infants' doses so that the correct dose can be administered. Too much of the drug could cause serious side effects, whereas an inadequate amount of drug may have little or no effect. For nitroglycerin, EMTs are advised to administer one dose, one tablet or one spray, and repeat it in 3 to 5 minutes if there's no relief, to a maximum of 3 doses, including any dose the patient may have already taken before the ambulance arrived. Administration refers to the route and form in which the drug is given. The EMT administers medication sublingually, orally, by inhalation, or by injection. Alright, the action, or the therapeutic effect, or the mechanism of action. Alright. Provide the justification for administering a particular medicine. If the action described will not produce the desired effect, then the drug should not be administered. Actions of nitroglycerin include relaxation of blood vessels, vasodilation, and a decreased workload of the heart. The desired therapeutic action of epi are dilation of the bronchioles and constriction of the blood vessels, which help relieve a severe allergic reaction. However, epinephrine also causes an increased heart rate. This is an undesirable side effect of epi. Nitroglycerin's therapeutic effect is relief of chest pain. Side effects of nitroglycerin include lower blood pressure, headache, and a pulse rate change. Keys to medication administration. You have to obtain an order from medical control, select the proper medicine, verify the patient's prescription, check the expiration date. You want to check for discoloration or impurities, verify the form, route, and the dose, check the 5 rights of patient medication. Right patient, right medicine, right dose, right route, right time, right documentation. You need to know, there's actually 6 or 7 now. You need to know the 6 rights, of medication administration. Right patient, right dose, right medicine, right route, time, and documentation. Restating the drug to be administered, the dose, and the route when receiving an online order reduces the chances of improper medication is inadvertently administered, the wrong dose is given, or the inappropriate route is used. It may be necessary for you to make a judgment as to whether the patient can tolerate the administration of the medication. For example, you may have received an online order for the administration of oral glucose. The patient was talking incoherently when you called medical direction for the order. However, their mental status has deteriorated and now they are only responding to painful stimuli. So even though the medication order exists, it's now inappropriate to administer the oral glucose to this patient. Once the medication order has been received, it is your responsibility to ensure that the proper medication has been selected. You need to make sure you read your medication labels carefully. When the medication to be given is not carried on the EMS unit and must be obtained from the patient, it's important to verify that the medication is actually prescribed for that patient and not some other individual, such as a spouse, relative, or friend. Some patients may take medications that aren't specifically prescribed for them. They believe that if the signs and symptoms are similar to those of someone who is taking the medicine, then it's appropriate for them to take. To avoid medication administration errors, it's vital to check the prescription label and verify the patient's name. You should never administer medication that's not prescribed for the patient unless ordered to do so by medical direction. Some medication labels aren't affixed to the medication container itself, but are placed on or inside the box or other outer packaging. Nitroglycerin, epi auto-injectors, and metered-dose inhalers are packaged this way. If your patient has one of these medicines, you will not be able to tell by looking at the container if the medicine has been prescribed to this patient or not. The outer package cannot be found. You must determine through careful questioning if the prescription truly belongs to your patient. Depending on the type of packaging of medication, the expiration date is either printed on the container or on the prescription label. Properly dispose of expired medicines according to your state drug and pharmacy guidelines. Epinephrine or any other medication that comes in liquid form should be inspected for any discoloration or cloudiness prior to the administration. If the medication appears to be cloudy or discolored, or any particulate matter is found in the container, do not use it and discard it. Some drug packages are similar but contain different doses. For example, you have the epi auto-injector, comes in adult and pediatric sizes. The packages look very similar, but without close inspection, it would be easy to mistake one for the other. Administering adult dose to a child could have detrimental effects, whereas administering a pediatric dose to an adult may have little to no effect. You have the right patient, medicine, route, dose, time, and documentation. It's your 6 rights. Documentation. You want to document the drug, the dose, route, time, and any changes in your patient's condition. All right, during the assessment, assess the adequacy of any other care that has been administered to manage the patient's condition. Based on the care provided, determine whether improvement or deterioration in the patient's condition has occurred, and document any improvement or deterioration. Be prepared to re-administer Narcan in the known or suspected opioid overdose patient if there's no response to the initial dose. The initial dose was not enough to adequately reverse the respiratory depression or hypotension. The patient's mental status deteriorates and any respiratory depression and or hypotension reoccurs. All right, sources of medication information. Poison Control Center. You have an EMS Pocket Drug Reference Guide. The PDR is a good thing, okay? It's what a lot of doctors use in the emergency room. His name's partner assists the patient's ventilation. Nate Miller reviews the protocol for anaphylaxis, which allows him to administer a patient's EpiPen in such circumstances. He confirms that the medication belongs to the patient and checks the name, dosage, and expiration date. He administers the drug by IM route and prepares to repeat the primary assessment and perform a secondary assessment. Fortunately, the EpiPen begins working quickly, but Nate knows that its effects are short-lived and that they must work quickly to get the patient to the hospital. All right, there's your chapter 14, medication and pharmacology.